Welcome to the series Debunking Wellbeing Myth in Leadership. The myth debunked today, well-being is a personal matter. Well, it is not. A recent US study by the American Psychology Association done in 2021 revealed that 3 out of 5 employees in the US said they have experienced negative impacts of work-related stress in the past month. That means their well-being was getting a hit through work. The vast majority of employees, a stunning 87% of that survey, thought that actions from their employers would have helped their mental stress. What this help could look like, we will discover in a later video. 71% of those stress-impacted employees considered leaving the job, and that's not what leaders want. And you know, it is not always about investing money into well-being or higher salaries. When my mom had a medical procedure last year, I was in touch with her nurses in hospital. They were so stressed, they literally ran along the hallways to get to all the patients in time because they didn't have enough staff, a problem many industries face at the moment. But what stunned me the most was that they said the biggest complaint wasn't about getting enough money or not having enough money. It was about not feeling that they were seen and heard, that nobody really took the time to listen to their needs and to their ideas for improvements. For example, creating a more flexible time management system and having more agency over those aspects of work. They really felt they didn't matter to the organization. Which brings me to a big part of what well-being is. Our need for social connection and for being seen and feeling valued. Kenneth Pelletier from Stanford Center of Research and Disease Control put it that way. A sense of belonging appears to be as basic a human need as food and shelter. We are hardwired for social connection, so feeling that we're in this together at work, that we take part in something bigger, that we can reach our goals together, that our effort is valued, not only monetary but in appreciation, is what builds resilience and contributes to well-being. Agreed, well-being also is a personal thing. There are many things I can do in my life to feel good and function better. I can look after my physical health. I can meet friends and make sure I have enough downtime outside of work. I can put effort into all that. Yet think about how many hours a day most of us spend at work. That personal well-being effort needs to be matched at work. We don't leave our personality at the door. Only taking care of our well-being at home doesn't work. Especially as we have seen in the statistics at the beginning, when personal well-being is compromised by work-related issues. So well-being literally is a two-way street between personal and organizational effort. That is also why many of the attempts of companies or NGOs to provide well-being apps for their employees to increase self-care failed. It's not that these apps are bad. Many of them can be a tremendous support for de-stressing or for practicing well-being tools. But done in isolation, without supporting those efforts in the organization, puts the responsibility completely back on the individual. Michelle Barton demanded in an article at Harvard Business Review to stop framing, as she says, wellness programs around self-care. She picked up on the backlash from many employees who complained that these apps added another level of stress and another level on the to-do list, instead of actually helping them. As one of my clients put it during the pandemic, if I hear the word self-care one more time at work, I jump out of the window. I have too much to do as to worry about that as well. So the meaning behind that is that people don't want to be left alone with their well-being. They very rightly see well-being as a community effort where their input matters, where everyone is invited to contribute to a whole, and where equally everyone is getting supported by the community when needed. Let me give you an example of an organization where well-being was improved accidentally. One department in the organization that I worked with had the idea to start a monthly themed lunch where everybody in that team brought in food and they contributed and they had a theme and then they had a beautiful lunch together. What started out as a fun activity became a thing that other departments really picked up on, and soon teams cross-invited each other. The benefit was not only eating interesting foods or having fun. People learned more about each other. They shared stories. They also started understanding better what the others were working on. So collaboration and shared problem solving started, and it increased. They developed social connections, which not only benefited their well-being, but actually their productivity. This didn't cost a lot of money. It didn't take a lot of process design and a big rollout. It was a couple of individuals taking action and taking things into their own hands. I know that lunches by far cannot fix the well-being needs of a company, but initiatives like that help to get more action started. So yes, well-being is a work matter. And yes, leadership should be involved in well-being matters. It is important to do surveys and finding out what stress hotspots are and doing satisfaction ratings, offering apps and well-being lectures and yoga, all that, do it. But what's actually really important as well is that the leader shows up. You show that you care. Go to the teams, listen intently to the people, ask what they consider well-being to be and what they think would help them improve it. Let them try out ideas. And yes, strengthening social connection on a regular basis is a well-being booster if done authentically and with ownership of the people and not done to the people. There we go. Myth debunked. If you want to learn more, please subscribe or get in touch with me. I would love to have a conversation. My name is Dr. Elke Paul. I'm a well-being leadership expert and I dare you to lead with well-being.